Namaskar, sir.
Namaste. So, yeah, uh, shall I share it because it's a big file?
Sir, actually, we are just testing it likely before so that we don't face any problem during the session.
Yeah, no, share to you. I'm trying to what do you call
Uh,
share.
so you see a icon of share at the left of the leave button, na? From there you can share it.
Okay.
Yes, sir. You tap on the share, then you select the full entire screen option. Then you can share your PPT presentation. You select your PPT now, sir. I think it will be displayed. Your screen is visible to us.
Is it visible?
Not yet is net, sir. Sir, you selected the entire screen. Yes,
Entire
sir.
screen.
Yes, sir. Now you can open your PPT, sir. Yeah, just open the PPT tab. It will be visible, I think. Yes, sir. This one. Yes, sir. Now it's visible, sir.
Is it?
Now
It's
you
visible,
can
no?
go. Yes, now you can go to the entire screen option, sir. It is
Yeah.
left to the that zoom bar where it is written 77% to the right of it. That's it. So that's we are able to see that.
No,
Uh,
it's okay.
yes, sir. Kindly do the next slide, sir, so that see we can. There's no time lapse in swapping. Okay, sir. Next, sir. It's fine, sir. It's fine, sir. Thank you
Okay.
so much, sir. We will start the session soon.
Okay, thank you.
Okay, sir. Okay, thank you.
Another close for me.
We will start the session soon. Some students are still joining.
Send it on your WhatsApp also. Namaste. Okay. Okay.
सभी को नमस्कार. Director Mark is joining us.
Namaskar.
Namaskar,
Dr. I hope I'm audible. Namaskar to all. Namaskar,
Yes, ma'am.
Dr. Srivar. Yes. See, sir, we are waiting for rest of the participants. As I can see, only 61 participants have joined this. So we have to make few important announcement. So I will be taking that in the end of the session.
Okay, ma'am.
We request you, sir, please proceed with the PPTs. Thank you.
Okay, ma'am. Okay. Am I audible to all?
Yes.
आदरणीय सभी महानुभव महोदय, आरएबी के शासन निकाय के सदस्यों, गुरुजनों, आज के अतिथि वक्ता डॉक्टर एनवी श्रीवत्स महोदय, विद्वानों, शिष्यों और दर्शकों को बहुत बहुत शुभ दोपहर, जो आज ज्ञान गंगा एक ज्ञान यात्रा साप्ताहिक वेबिनार श्रृंखला के 198 एपिसोड में हमारे साथ शामिल हुए हैं. मैं डॉक्टर जितिका दुग्गल आरएबी की ओर से आज सबके लिए आप सभी का स्वागत करती हूँ. सबसे पहले हम अपने उन मार्गदर्शकों के प्रति भी अपना हार्दिक आभार व्यक्त करना चाहेंगे और उनको स्वागत करना चाहेंगे जो इस श्रृंखला को जारी रखने के लिए हमारा मार्गदर्शन, प्रेरणा और प्रोत्साहन करने के लिए हमेशा मौजूद रहे हैं. आदरणीय पद्म भूषण वैद्य श्री देवेंद्र त्रिगुणा जी, जीबी के अध्यक्ष आरएबी आदरणीय वैद्य श्री राजेश कोटेचा जी, सचिव महोदय आयुष मंत्रालय आदरणीय डॉक्टर वंदना सिरोहा, निर्देशिका महोदय आरएबी। मैं आज के विशेषज्ञ डॉक्टर एनवी श्रीवत्स सर का परिचय कराना चाहूंगी, जो एप्लीकेशन ऑफ मर्म चिकित्सा इन कॉमन मस्कुलोस्केलेटल डिसऑर्डर्स पर प्रकाश डालने जा रहे हैं। सर ने 1989 में बीपीएसवी आयुर्वेद कॉलेज कॉटिकल से स्नातक की उपाधि प्राप्त की है। सर ने 1993 में सरकारी आयुर्वेद कॉलेज तिरुवनंतपुरम से स्नातकोत्तर की उपाधि प्राप्त की है। सर के पास चिकित्सक, शिक्षक और सलाहकार के रूप में लगभग एक दशक का पेशेवर अनुभव है। सर ने कई राष्ट्रीय और अंतर्राष्ट्रीय संगोष्ठियों में भी भाग लिया है। सर को आयुर्वेद बिरादरी के विभिन्न संगठनों से अग्निवेश अवार्ड और भिषक अवार्ड को भी सम्मानित किया गया है। मैं हमारे सम्मानित वक्ता को सत्र शुरू करने के लिए आमंत्रित करना चाहूंगी। धन्यवाद।
Namaste. Can I start, madam?
Yes.
Namaste to all who are present in this audience. Thank you, Dr. Jeetika Dugal, for this introduction, and I'm very happy to be a part of the Gyan Ganga program of the Rashtriya Ayurveda Vidyapeeth, which has been conceived by the leaders of Rashtriya Ayurveda Vidyapeeth. It is a program which helps us to share the knowledge to the between the thinkers and scholars of Ayurveda, along with their shishyas. So at the outset, let me give my acknowledgements and thanks to the Ministry of Ayush and all the leaders of the Rashtriya Ayurveda Vidyapeeth, led by Dr. Vandana Siroha, the governing board members and seniors like Achyut Tripathi sir, Sri Krishnan sir, and all who have gathered for this session. My regards to all Shishyas also for having shown interest to see what is there in the Marma Chikitsa in orthopedics or common musculoskeletal disorders. We'll go to the program. I'll start sharing the slides with you.
Dr. Jitika, are you there?
Yes, sir.
Yeah, please see. Maybe there is no signal on their side.
Okay, ma'am.
Nothing is visible. Please see that.
Yes, ma'am.
Hello.
Hello. I have called our speaker. He is rejoining due to some error. The previous slide was left out. Sir is rejoining in some time.
Sure.
Yeah, sir has joined.
Not visible.
Yes, sir. You can share the slides, sir. Slides are not visible. Yes. It's visible now.
For the break. It's visible and I'm audible?
Yes, sir. Yes, sir. It's completely audible and visual. It's fine, sir. We can proceed.
So regarding Marma Chikitsa, it was rather discreet, or it was very mystic, and then very less people were practicing it from the Ayurvedic sector also. So at that time, there was from the ground where the bone healers were doing this, bone setters were doing, as well as the Marma Chikitsaks in the villages were doing the practice. In Trivandrum Ayurveda College, it was academized by my gurus, I can tell, and that's how the academic version of the Kerala Marma Chikitsa has happened. And how the importance of that, the knowledge of Marma is half the knowledge of Shalya Tantra is really proven when we know that the orthopedic or the musculoskeletal conditions are also dealt, because there are we have more of the Asti Marmas, the Mamsa Marmas, the Snayu Marmas, the Sira Marmas, which are associated with any injuries to the bone. So all have to be known, and that gives a chance for the orthopedicians or the those who are dealing with the injuries of the musculoskeletal conditions, or which is all the Nija disorders which happen in the Marma region, to discuss about and study about the real application of Marma. So I'm not going to describe much about the definitions of the Marma and all. In short, we here define Marma as those Marma Chikitsa as the Chikitsa part of Shalya Tantra which deals with either traumatic or non-traumatic conditions which can occur, which will be involved either with circulatory disorders or sometimes complicated with neurological disorders, or both also. So whatever we get as cases in our patients in front of us in our clinics will be having a pain as the biggest problem, and disability, loss of movement, etc. are the other things. So loss of function also. So Marma Chikitsa is an important area as far as common clinical practice is also concerned. And the knowledge of Marma will give us a chance of understanding how we can approach that patient in a good way. A simple example is that once we know that the patient is coming with, we will be discussing such cases, when patient is coming with weakness of the upper arm, and who is coming up with the wasting or the muscle wasting in that, then as a Marma physician, I will always think about what happened to his Amsaphalaka Marma or the Amsa Marma. So this is the basic way what we call, I tend to call it as if we are applying or using the Marma scope, like the stethoscope. If we understand to know the Marmas and their injuries, their consequences of the injuries, the sequel of the injuries, then that knowledge, we can see that once we apply to look at that clinical case with the Marma scope, we can identify that cause of it and what is the reason for it, and to remedy it. Because we all know that Samprapti Vikatanamev Chikitsa, Nidana Parivartanamev Chikitsa, etc. And Marma Paripalanam has been told as the basic concept in Tramarmiya. So here also we can understand that Abhada Varjanam Nityam, that is, any injury should be avoided, or any chance for injury, a safety measure has to be taken. Then we know that Swastavartasya Anuvartanam, daily what you call, take care of the health of the healthy, so that the Marmas, Trimarmas have to be kept healthy, the other marmas which are dependent on the Shakti of the or the Prana Shakti of the Trimarmas have to be kept normally. And Utpannarthi Vigadanam, Marmanam Parivalanam. Utpannarthi Vigadanam is if any disorder, disease, or any injury happens to any of these marmas, they have to be kept treated properly immediately, especially for the three Mahamarmas. So other marmas which are dependent on that, they also cause pain or the Ruja or Vaigalya or Pranahani which is Sadhyo Pranahani or Kalantara Pranahani. So based on that, this is a very important subject for anybody who is practicing Ayurveda. And Marma Chikitsa is not, I believe that it is not a private property of any Marma Chikitsa, Marma qualification. That skill has to be there. But a basic BAMS student, he is studying Marma Vibhaga in Sharirasthana, and he or she is undergoing that lessons, what is happening to a Marma when it is having injury, what are the Snayu with the Marma Lakshanas, what are the Asti Marma with the Lakshanas, what are the Sandhi Marma with the Lakshanas, etc. So and in Vadavyadi Chikitsa, again in Nidana it will be told that Marma Abhighada is one of the reasons, etc. So here in this paper, I will give the conditions also, and from Ayurvedic point of view, when we apply the Marmascope, even in which are the Vegas which can be affected, which are the Vayus which can be affected, what is the role of the Marmas in Anatmaja Vyadis, those things I will be trying to discuss. So I go into the subject now, please be with me. Now right away we go into with that introduction, we go into the conditions of the disorders of the neck or clinical conditions. So cervical spine conditions, cervical myelopathy. Nowadays I tell that we can translate all these terminologies into Ayurvedic terminologies, and we have now the accepted terminology by WHO also. So, but for understanding, as we are in the new gen, we can understand the disease from the point of view of the modern description, but think about the disease in terms of Ayurvedic terminology and Ayurvedic principles and Marma principles. This is the easiest way of approaching, to convince the patient as such also, as well as to get a good approach in the treatment line also. So that's why we are using all these modern terms over here, which are really comparable with whatever conditions we are telling in Ayurveda. We'll come to that. So cervical myelopathic patients are coming many times with weakness of their limbs, especially the limb girdle syndrome, like compression of the spinal cord in the cervical region. That is one of the things. Then stiff neck. That is one of the most usual thing also, where after they get up from the bed, they find that they cannot move the neck. So stiff neck. In children, it happens as child torticollis, etc. That postural torticollis, also called as a wry neck, condition occurs when a baby's neck muscles tighten, causing their head to tilt to one side. This can happen in some conditions in adults also, but usually seen in this postural torticollis is seen in children. There are conditions like Erb's palsy and Klumpke's palsy, which are actually complications which occur due to shoulder delivery, where a traction is given to deliver the baby, and that traction will affect the nerve roots at the C5, C6 level, or damage from C8 to T1 level. The first one, it results from neuronal damage to the C5, C6, is called Erb's palsy, causing full or partial paralysis of the arm, often accompanied by loss of sensation. Klumpke's paralysis damage to the lower C8 to T1 nerves. You can say that policeman taking tips and other conditions which are mentioned in the neurological. Whenever there is a neurological damage, we have to understand that if it is a neuropraxia, which is only a damage at the axon, which is like a concussion, very small, then it is a naturally recoverable condition. But when it happens on the, like axonotomesis, it is called, when the axon is cut or axon is severed, then we know that it takes a long time to, like a nerve can grow only a millimeter per month. Like so, the repair also is a longer one, and it is kashta kricharasad. But when it is affecting the nerve, it is called neurotemesis, where you see that there is no recoverable thing. It is a permanent damage, and that's how from those things we can understand why some marma injuries cause pain only, some marma injuries are causing disability, and some causes permanent disability. So, and some cause loss of life also. So if it is at a higher center, then we can say that there is a loss of life also. Pain, if it is so severe like pain shock, then also this happens. So now this is a picture of you can see that typical torticollis where the nose and the face rotates. It is a right-sided, right ear tilts towards the right shoulder. In this picture, the tight right sternocleidomastoid muscle. Sternocleidomastoid muscle is the muscle which connects the sternum and the clavicle cleido to the mastoid. So this pain conditions very much come nowadays also, because so many of us are working on having soft skills to work in computers, and we can see that IT sector, more people have to sit in their computer for more than 8 to 10 hours per day. And if they are having any uncorrected vision, sometimes they tend to bend their neck to one side when they are doing. And usually it happens also. If we are a right-handed person with the mouse in the right hand, we tend to bend to the left side. And long hours like that, without changing the position, without blinking the eyes, without moving the neck muscles, will give a condition similar to this dry neck. So we have to understand such a thing. Then disorders of the shoulder, now from the neck when you are coming, I am giving some samples only. Frozen shoulder or periarthritis, characterized by stiffness and pain in the shoulder joint, where the shoulder joint capsule become thick, stiff and inflamed. I think this is one of the very much popular case which will be coming into a Ayurvedic clinic, where the patient comes and tells that I am not able to lift the upper limb, and already the doctor had done an X-ray, and then he has told that it is a frozen shoulder. Actually, there is a long way to get the shoulder fully frozen, right from simple periarthritic pain, which is limiting the range of movement. Once it is totally movable, we call it frozen. But this umbrella, the umbrella term is frozen shoulder. So shoulder joint capsule become thick, stiff and inflamed. So here we can see that it is periarthritis. It is not the osteoarthritis or the arthritis of the joint. Sometimes they are associated also. We have conditions called supraspinatus tendinitis. This is also a very common thing for any which comes, which simply in sports medicine, if you do something without warming up, or if you are starting even an yoga schedule without loosening exercises after a long time, or if you are doing something like pulling, pushing, without which you are not habituated, then that causes inflammation of the supraspinatus tendon. The supraspinatus tendon is the one which helps in lifting up the arm, presented with pain, discomfort, and restore mobility. Then recurrent dislocations, they also come, because sudden dislocations, sometimes they end up in the modern clinic and they get it operated or fixed up. Once they come to us, we do it with our bandages and other things. In such cases, if the first incidence of the dislocation had been very severe, then there is a more chance that the joint capsule have become very loose, and then there is more chance of it getting dislocated frequently. It's called habitual dislocation or recurrent dislocation. So you can see that this is a picture of the supraspinatus tendon. You can see the subacromial bursitis. There is another condition, and degenerative calcification is another condition. So in all these conditions, there are Nija conditions, there are Vigadaja conditions. All these things, this Marma Chikitsa will be helpful, along with sometimes medications which are required for that. You can see that calcification in that area also is shown. Now we can see one more, whatever we call it in the umbrella term as Ababahuga, where typical Ababahuga is defined in Vata Vyadhi, but Amsa Sandhi osteoarthritis or sandhigata vata or any other conditions also will lead to condition where you cannot lift it. It can be a snayugata vata, it can be a mamsagata vata, it can be situation where there is impingement like this, shoulder impingement syndrome, where you can see that the subacromial bursa is there giving lining to it, supraspinatus muscle is there, supraspinatus tendon gets impinged over there. So you can see that there it becomes painful, and this is called a painful arc syndrome, where typically the patient can lift the arm up to 60 degrees, and from 60 to 120 degrees it will be painful, and above that once he is doing, there will be no pain. So this is a very typical condition where we can call it as the shoulder impingement syndrome. Then we have the adhesive capsulitis, where you can see that it's a frozen shoulder, where all the things which are the rotator cuff muscles are there above this capsule, and the capsule becomes fixed like, so that there is no movement of the upper limb at the axilla itself. So this may be due to chronic inflammation, which leads to adhesion. Again, another area it becomes inflamed, it becomes adhes, and it is a consequence of periarthritis also. So you can, one side you can see the normal joint capsule, in another side you can see the representation of the affected, this one, where there is a layers of inflammation, there is thickening of the joint capsule, and then the adhesions. So painful arc syndrome refers to shoulder impingement syndrome caused by the repetitive shoulder activities causing shoulder pain when the arm is raised above the shoulder level. Now another condition, as I told, is the supraspinatus calcification drop arm syndrome, referred to the rotator cuff tear. Another condition is the drop arm syndrome, refer to a rotator cuff tear or a test to assess the stability or the integrity of the rotator cuff tear. Here we can see that because the rotator cuff is torn, nowadays these we are actually in one way fortunate, because most of the orthopedicians send them for an MRI, and they come with an MRI report, and then they ask that this is torn, whether we can repair it. So in that test, the drop arm syndrome, where you see that once you lift the hand, then it will be, the patient will not be able to hold the arm in that position, but it will drop off. We come to the disorders of the elbow or the kurpara. Now, before that, I would like to make everyone understand that once we know the Sharira properly, the Amsa Sandhi is not the Amsa Marma. Location of the Amsa Marma and the Amsa Phalaga Marma are different from the Amsa Sandhi. So that one thing we have to remember, every time it is not the name, site and the name may not be the same. So here we come to the Kurpara Marma or the elbow. Tennis elbow is a very common condition known as the lateral epicondylitis, condition that can result from overuse of the muscles and the tendons in the elbow. Golfer's elbow, known as the medial epicondylitis, caused by the overuse of the medial common flexor tendon of the elbow. So one is usually seen in the tennis players, where they do the backhand shot, and in the other one, golfer's elbow, the medial epicondylitis is seen due to overuse of the medial common flexor tendons. So here these are nuisance conditions. We know that patient is actually okay. You don't see any visible deformity or this one, but patient tells that I am not able to lift a file, I am not able to lift a bag, I am not able to wring my clothes, I am not able to make chapatis, something like that. So these are the conditions we would understand. Lateral epicondyle picture representation I have given here, where you can see that the lateral epicondyle is there, injured inflamed tendon is there, the extensor muscles are shown, and the humerus is the muscle, humerus and the radius form the elbow joint over there. Disorders of the wrist. Now we come down to the wrist. I am telling about the major conditions which we get in the clinic only. So actually each and every part of the body, like shoulder joint or elbow joint, you know that even if we talk for 3 to 4 hours, there are so many conditions and the diseases to be discussed. Now, disorders of the wrist, tenosynovitis, this is also very common nowadays. Now people are coming with the, after the smartphones have come with the sliding with the what you call soft screen. We have many people coming with these conditions because always the tab or the smartphone, we tend to overuse it because we are using it for typing and communication and other things. So these are conditions which are very common now and which are sometimes a Chudra Roga, like which is always disturbing. So these conditions can be dealt very well with Marma Chikitsa, which are also dealt sometimes if it is apt situation, understanding that snayus are involved, we can do Upanaha, we can do Daha, Dahana Karma, Snehana Karma, etc. So inflammation of muscle sheath where muscle connects to the bone, it is painful condition often affect the hand, wrist and the feet. Even in feet it can be happening. So tendon and tenosynovitis is the lining of the or the sheath which muscle sheath converts itself into the tendon, muscle converts it to the tendon, so the covering also converts it into the covering of the tendon and that gets inflamed due to irritation, maybe by if it is passing through a bony canal which is formed due to the joints. There usually you can see that the carpals are 8 in number and the space in between them are very less, and through that the nerves are going into the hand and the blood vessels are going into the hand. So whichever in Marma language, whichever is carrying the or conducting the prana shakti, they can get clogged there, they can get sangha there. And so these conditions, that's why they end in pain syndromes like either swapa or daha or ruja, etc. in these conditions. So carpal tunnel syndrome, numbness, tingling and pain in the hand and forearm occurring when the median nerve in the hand is squeezed or compressed. De Quervain's disease, inflammation of the tendon sheath that moves the thumb upwards. Usually the patient comes with the pain below the thumb in the wrist region. Repeated stress injuries, wrist drop conditions which occurs when the wrist and the fingers can't extend fully because of the injury or damage to the radial nerve. We can say that the patient will not be able to dorsiflex. Deformities or ulnar drift, known as the ulnar deviation, it is a hand deformity that causes the fingers to bend towards the ulnar bone or laterally. In an anatomical position, if you see that the fingers compared to this one will be moving away from the body. So these are some of the conditions. You can see that the fingers now with the ulnar deviation due to osteoarthritic follow maybe a complication of the rheumatoid arthritis which occurs over here. So I'm showing some pictures because the visible pictures will make it more understandable. Now we always come across trigger finger when the patient comes and tell that I have pain when I am moving my fingers, when I am closing my fist, the fist I am not able to open some of the fingers fully. So it then pops and then triggers and then opens up. Sometimes if it is inflamed there will be pain. And if there is no pain, then also the patient will have to give an extra effort to open out that finger. It is a condition in which one of the fingers of the thumb catches in a bent position. Finger or thumb may straighten with a snap-like trigger being pulled and released. So it is like a gun trigger being pulled and released because that opening will be like that. Then we have, as I discussed, so many deformities like swan neck deformity and bottom-ear deformities, which are conditions due to Vadarakta, where in severe Vadarakta, Gambhira Vadarakta, when the Asti, Majja are affected, then Vakrada occurs. Condition affects fingers in which the base of the joint bend inwards, the middle joint straightens, and the outmost joint bend inwards. It is a swan-like deformity. Button-ear deformity in this middle joint of the fingers bend inwards while the outmost joint bends outwards away from the palm. So all these things I think basically everyone knows. I am just trying to it's not moving. Okay. Now, Klumpke's palsy picture, you can see the wasting of the muscles and as if the deformity occurs when the nerve is injured at the axillary level, axilla level. You can see that this is the trigger finger where you can see that the tendon is affected. There will be a nodule also sometimes in the tendon. You can feel that nodule because the tendon sheet has thickened, and that will lead to this one. Here you can see that this is called a mallet finger, or when the tabla players play on the percussion instrument, how he keeps it. Mallet is a hammer, so like hammering, the distal phalanx will be bent like that. Butner deformity we already defined, and this swan neck deformity. So in all these things, how Marma Chikitsa is effective is, Kerala Marma Chikitsa is very effective by following the Sneha Snedana methods and the proper massage methods over there. Disorders of the upper and lower back, we will come now to the back where the dorsal spine conditions are. Kyphosis is one of the conditions, scoliosis is another, and you have other conditions like mechanical back pain, lumbago, etc. Kyphosis is also known as hunchback or round back, kubjada we call it, in which an excessive outward curve of the spine results in an abnormal rounding of the upper back. When you see the patient itself, he will be hunchback. His head will be tilted from the, when you take the coronal plane, it will be shifted to the anterior side. Now, it's a very, we can remember the character of Mandara in Ramayana with a hunchback like. So, that is kyphosis. Scoliosis, if we start discussing on the anatomy of the spine and all, it will be very long process. We have to understand one thing, that the backbone is not straight. Backbone has a normal curvature at the cervical. There is a cervical kyphosis. There is a then dorsal. Then there is again a lumbar. This one bend over there. So this picture we will have to bear in mind, which I will show you. So it is also known as hunchback and round back. Now scoliosis, it's a side-to-side curvature of the spine. The curvature can be in any part of the spine, but usually affects the upper spine or the dorsal spine and lower back. It's very common in it has developmental scoliosis in young children who are female usually. Lumbar and lumbosacral conditions, there is mechanical and back pain, lumbago pain in the lower back region. So here you can see that the normal as well as the kyphotic, this one. What I told, that the head will be moved forward or anteriorly. Here you can see that conditions of the lumbar spine. You can see that compressed lumbar spinal nerve, just a representation of a herniated disc, how it can be a problem. Now this is an interesting thing, that as a Marma physician I can tell that anybody knowing Marma Chikitsa or Marma can handle this situation, which is sometimes some people go to the orthopedicians or orthopedic surgeons, and sometimes some people go to the neurologists or the neurosurgeons. And this is where the Acharya's vision is very great. I don't think that it is not because it was generally understood only and details were not known. Acharyas were knowing the details, but these conditions, when we look through the Marma, basics of Marma, as well as Dosha Chinta, we know that they have to be handled together only. There will be the impact of this herniated disc on the muscles, nerves, and all the tissues around there. So we are in a better position to handle it, because whether it is having more impact on the nerve or whether it is having more impact on the muscles around, or whether it is happening causing a stenosis of the spinal cord itself. All these things a Marma Chikitsa can think about, because a holistic thinking is basis of Marma Chikitsa. So we can see that the lumbar degenerative diseases also, so these are also dealt with by the Marma Chikitsakas, because it is a chronic back condition. We can tell that a degenerative disc disease, DDD it is called, will be reporting to the clinic. But patient would have been okay for a long time, but he will give a small history. I jumped or I stepped from one, the step was larger than deeper than I thought. and then I fell down or I had hit my heel, then the back pain starts. So you have to know that small abhigadas also can cause, in a degenerated condition, bigger pain. So normal anatomy of the this thing has been shown, and the ankylosing spondylosis. This is one condition where the loss of normal curvature occurs due to straightening of the spine. This is called bamboo spine, and radiological features like the ladder spine, bamboo spine, everything can be seen over there. The basic thing is that in ankylosing spondylosis, it is a genetic disease also, where HLBA27, if it is that gene is seen, there are more chances of it. And then where you see that there is an inflammatory phase, and there is severe pain at night, and resting pain will be there, and it is a condition sometimes called as autoimmune also. We have second phase in which we know that after the inflammatory phase, then there is a severe pain phase with loss of movement and straightening of the spine. So here now we typically see the sciatic nerve and its distribution. The Girdrasi, which we discuss, most common complication of an IVDP, intervertebral disc prolapse at the lumbar region, especially the L4, L5 region and L5S1 region, where the cords form the sciatic nerve. So we can see the patient comes with Girdrasi, and it may be due to the sciatic nerve compression at the level of the L4, L5 region. So these pictures show that the bulging disc, how they compress on the exiting nerve root. So this pain is called radiculopathy. It is called, if it is having a burning pain, it is called causalgia. So Acharya Vagbhata tells that Vishwaji Girdrasi, when it is Tivra Ruja, it is called Khalli. So patients will come in that very painful conditions. If the Chipra Marma and if the Indravasti Marma and all are compressed, or what you call, enough pressure is given and the proper pressure is given, the pain reduces a lot. So this is the effect of the Marma Chikitsa, when we know that these Marmas are on the line of the sciatic nerve, and once they are the Vata predominance there is controlled or at least arrested temporarily, there will be at least temporary relief from the pain. Disorders of the spine, IVDP, we already told that. Degenerative disc disease, told that. Radiculopathy, I have again told. Spondylolisthesis is a spinal condition in which a vertebra slips forward onto the bone. Usually happens at the L5, S1, L5 slipping over the S1, because up to the L5 it is a mobile unit and S1 is an immobile unit. So by some awkward lifting of weights and other things, it can be dislodged in a weak patient, or it can be due to a fall, etc., or it can be by birth also. Spondylitis, inflammation of the spine or vertebrae. Ankylosing spondylitis, an inflammatory arthritis affecting the spine and large joints. Sacroiliac strain, condition in which sacroiliac joints are pushed out of the alignment. So here we can see that there is a dislocation or the dislodging of the pelvis. Many a time when we follow only the pure anatomy or the anatomical description of a disease, we are missing many things, like the pelvic distortion, which is told much in the manual medicine and Marma Chikitsa. Many times we see that the Ayurvedic physicians don't consider. But when we see that X-ray itself sometimes will show that one of the half of the pelvis will be of one shape and half of the pelvis is another shape, where it has opened out, or it is the sacroiliac ligaments have ruptured, the pubic ligaments have ruptured. So we should be very careful in understanding all these things, and Marma Vijnana and proper orthopedic training will give this. So now you can see a picture of the MRI of the cervical myelopathic condition. You can see the spinal cord compression also. Then we come to the disorders of the hip. Stiff hip is an adduction contracture, a condition that limits hip movements and causes fixed adduction deformity of the hip joint. I know that many of us will not be very familiar with these orthopedic terms, but every Ayurvedic physician should be knowing what is adduction, what is abduction, what is flexion, what is extension of every joint. Then only he will be, even if he is doing Abhyanga, whether he is doing proper restoration of the movements of that joints which are affected even by normal pathology, he will be just able to justify. So everyone should be in touch with these words or terminologies. So adduction contracture is that the patient will not be able to abduct. He cannot move the hip outwards if he want to move the hip outwards. So neuralgia paresthetica is a condition caused by the compression of the lateral femoral cutaneous nerve, causing pain, tingling, numbness and burning of the outer thigh. Patient will come and keep his palm on the side of the thigh and tell that, sir, I have numbness over here. I have some burning sensation over here. And we sometimes just put it as it may be Urustamba like conditions, and then that's not Urustamba condition. It is typically a Snayu Vigara where there is Swapa, Daha, etc. Avascular necrosis is a typical damage of the head of the femur, and this has become very common after the event of the COVID. During the COVID, many people were forced to use, along with antibiotics, steroids. And these steroids, after long consumption, have damaged. Many people are having now, they are reporting to our clinics with AVM. It's called AVM. A painful condition occurs when the tissue of the hip joint dies due to disrupted blood flow. Perthes disease is very common in children because due to disrupted blood flow in the head of the femur. It was very common during our studies. Nowadays it is a little uncommon also. Here we can see that the healthy hip joint and the avascular necrosis. Then you have the healthy femur. You can see that the leg calves or Perthes femur, where again damaged femoral head bone in children usually. And there are some age-related conditions like Paget's disease in the adults also, which can be remembered. Now this is the neuralgia paresthetica, or the numbness of the lateral side of the thigh, where the lateral musculocutaneous nerve, femoral nerve is compressed over there. So pictures make us learn very much better, so that is why we can go through the pictures, or we can go through the pictures. Now we can see that the area of the pain, how it is shown as the red one here. Disorders of the knee: stiff knee, chondromalacia patella, softening of the knee joint cartilage. Chondromalacia patella. Malacia means thinning or weakening. Chondro means cartilage. Cartilage of the patella becoming weak. Post-operative mobilization. So even after all these knee surgeries, there can be stiffness, and post-operative mobilization is required, especially knee joint injuries in sports, etc. Sprain or collateral ligament injury is a soft tissue injury which occurs when the collateral ligament in the knee joint is overstretched. Knee is such a complicated structure, and Acharya Sushruta is very great in telling that it is marma. Whenever it is described, sometimes it is described as that vital point. But those marma chikitsa, Kerala marma chikitsa very clearly know that, and it is in Sushruta also, that it is not a point, it is not a vrihi samana marma, it is a triangular marma. So 3 angulas from the joint line, upper and downward, together 3 angulas. Any structure which is coming in the knee joint, they are hurt. It is Janu Marma Vigada. Many a times, if one structure is ACL is injured, there may be associated thing. We tell about the unhappy triad, etc. I'm not going to the details of it. Twisting injury, meniscus and cruciate ligament injuries. That's what it is: ACL tear, PCL tear, etc. Injuries that occurs because of the overstretch or twisting of the muscles or ligament. So this is the picture of the normal one with the chondromalacia patella, where you can see that the lining of this one is inflamed, and then it goes for degeneration. So you can see that another view. Whenever we are talking in the radiology, we will tell about the ABCs where the adequate views should be there. Usually we take the anterior posterior view, we take the lateral view, sometimes an oblique view. As far as knee is concerned, a skyline view is taken. Disorders of the ankle sprain or deltoid ligament injury. A soft tissue injury occurs when deltoid ligament in ankle joint is overstretched. Inversion injury is very common. The most commonest injury is the sprain inversion injury, which happens in sports, also known as lateral ankle sprain, occurs when the foot rolls inwards or underneath the ankle, damaging the ligament on the outside of the ankle. So these two types of injuries, sometimes overlapping each other, can occur, and that can go to that extent that it will have an avulsion fracture of the base of the fifth metatarsal, or it can damage the malleolus or both malleolus of the tibia and the fibula. So you can see that now we talk about the calcaneal spur, which is usually coming to our heel pain is coming. Many times we are satisfied by just taking an X-ray and tell that, okay, you have a spur and that is the cause of the pain. But I tell very clearly that every patient with spur need not have pain. So it is, whenever there is an inflammation only there is pain. And it is usually due to plantar fasciitis or any osteoarthritic changes which is happening, or a damage or a degenerative change which is happening at the junction of the facial attachment to the bottom of the calcaneum. So we should remember that. We can see that what is the flat foot and what is normal foot. So as age goes on, or in diabetic patients, there is damage of the bones, metatarsals, their alignment is gone and flat foot occurs. It occurs as a congenital disorder also. So it is called pes planus. Pes is foot and planus is flat. There are other conditions like pes cavus, where there is arch of the foot is more and curved also. Now you can see that the foot drop is one of the conditions which will come to our clinics. Inability to lift the front part of the foot off the ground, that is dorsiflex the ankle. This is done by the peroneal nerve, and peroneal nerve injury or any higher nerve injury can cause the foot drop. Ankle grade 1 sprain, grade 2 sprain and grade 3 sprain, where the total tear occurs. So these are for technical or academic knowledge. But we have to see that why we should understand is that our prognosis as well as the time for treatment depends on whether it is a grade 1 injury or a grade 2 injury or a grade 3 sprain, which is known more by clinical this one and also MRI. Now this is one condition called hallux valgus, where the big toe moves laterally. Hallux valgus and hallux varus is very rare. This is also called hammer toe, when one of the bigger toe stands upon the second toe. So now we make a diagnosis of the patient. We ask the patient if we suspect any flat foot or pes cavus, hollow foot, high arch foot. We ask the patient to wet his foot and then walk in a dry area in our clinic. And if you can make a film of it, or you can see that this will be the type of the middle one is the normal foot, the left one is the flat foot, and the picture of this one. So this is a very easy test because we are not able to judge otherwise. Calcaneal spur, plantar fasciitis, flat foot, arched foot, club foot. Club foot is a congenital or acquired defect where one or both the feet rotated inwards and downwards. So club foot is quite a common condition among the congenital disorders. Foot strain or hallux valgus is common foot deformity that occurs when big toe shifts out of the alignment and towards the other toes. We described that. Posterior heel pain, one of that is may be due to calcaneal spur. Foot drop also we have discussed. Now we come to the Ayurvedic point of view of the musculoskeletal conditions. We have to take cues from the Vata Vyadhi Nidana. Doshaja Marmagada or Marmachova Nidana. Different unwholesome food habits. So that's why Swastavartasya Anuvartana has been told, if we don't follow the Ahara Vidhi properly, there can be Vata Vriddhi. And if the Vata Vriddhi is affecting a Marma region, you know that along with the wrong Vihara, Usually here more than ahara, we have to consider the vihara also. So occupational diseases all come under this. Suppression of urges are vega, rodha and vega udhirana, forceful evacuation of the urges. Diva sopna, day sleep, jagarana, keeping away at night, excessive sexual act, ati vyavaya, and excessive exertion, ati vyayama. All this can cause marmachova, which will lead to a elevation or increase in vata, which will result in painful situations. So now just we can, I think many of the scholars are there. I would like to get a feedback from them. My view is from the Marma point of view, how Marma knowledge helps to understand the Vegas implication. Why in such Vegas, which all Marmas can get affected and why those Lakshanas will be coming. So Adhovada Vega Rodha will cause a pressure on the Guda, Hridaya, Stanarohida, Stanamola, Abastamba, Apalaba, Nitamba, Apanga, Kadika Durana, Kukundara. Here I very plainly tell that I have summarized this from various books also, but according to the if Adhovada Rodha causes Shirashula, it causes Kritshula, then we can understand that Adhovada Rodha is not limited to Apana Vaigunya only. It can affect the, like in Arsho Samprapti, Arsho Purva Rupa, it can affect the all the Vadas like the Samana Vayu, the Vyana Vayu, the Udana Vayu and the Prana Vayu also. So which are the marmas which are localized over there? From that we can derive that. So Shakrit, Shiro marmas, Uro marmas, Guda, Nitamba, Hridayam, Sringadagam, Avartam. Mutra Vegaroda causes Vasti marma, Vigada, Vitapa marma, Shiro, Uro marma, Nidamba, Guda, etc. Udghara will cause Vigada of the Hridaya, Uro, Shiro marmas, Sringadagam, Avartam, etc. Now Shavadu will cause Shiro marmas, Neela Manya, Simanta, Krikadiga, Sringadaga. So here see Neela Manya also is affected by Shavadu. Shabda, Rasa Ajnana can lead to. Vag Pravarti Nigraha can lead to. Trishna, Vidura, Shiro Marma, Hridaya. When Trishna Vega is done, Vega Rodha is done, Badirya is told. So we can see that Vidura Marma is getting affected over there. Shut, Shiro Marmas, Simantam, Shankam, Avartam, etc. Kasam, Hridaya, Uro Marmas. Nidra, Shiro Marmas, Apanga, Simanta, Shanka, Avarta. Now Sramaswasa, Hridaya, directly. Jrumba, Shiro Marmas, Simanta, Shanka, Avarta. Ashru, Hridaya, Manya, Shiro Marmas, Apangam, Neela, Simanta, Shanka. Chardi, Uro Marmas, Hridayam, Shiro Marmas, Simanta, Shanka. Shukram, Bidabam, Vasti, Hridaya. Now, Marmagada and Vadavyadi, if you take Apatandraka, we can see that the Hridaya Marma is directly responsible for that. Anusramsa, Anusandhi, Neela, including Neela Manya and Matrika may be affected. Ardida, Neela Manya Avarta Pana Vidura. I am very happy to tell that once we read through the Ardida and what are all the Lakshanas which are coming, if we relate it to the Marma Abhigada Lakshanas of the Shiro Marmas, we will find that these are the marmas which are affected, which I think in general studies we don't do. We never, I think, use the knowledge of marma in defining the diseases or the role of it in causing the lakshanas. So I would like every scholar to think about that and come up with opinions on this one which I am presenting. Ababahuga, Amsa, Amsa Palaga marma. Ganja and Pangu, Kati Sandhi, Krikadiga, Kadiga Tarana, etc. Urustamba, Ani Marma. Ani Stamba directly it is told causing Urustamba. Proshtuka Shirsha, Janu Marma, Vadakantaka, Gulfa Marma, Badirada, Vidura, Mugatwa, Neela Manya, Minminitwa, Neela Manya, Gulfa, among the Nanatmaja Vadavyadis I am telling, Gulfa Graha, Gulfa Marma, Janu Veda, Janu Marma, Janu Vishlesha, Janu Marma, Urustamba, Ani Marma, Guda Brahmsha, Guda Marma, Guda Arti, Guda Marma. Shroni Veda, Kadikadarana and Kukundara, Hrudrava, Hridaya Marma, Griva Stamba, Krigadiga Marma, Hanustamba, Neela Manya, Shanka Veda, Shanka Marma. Shanka is a very important area. We can see that even it is a told that whenever there is a disease in Shiroroga called Shankaka, it can kill you in 15 days. So Ardida, Nila Manya Vidura Avarta Fana, Tragagraha, Kadikadarana, Kanjada, Kadikadarana, Kukundara, Janu, forgot to mention it, Badiriya, Vidura Marma, Grananasha, Panamarma, again Mugatwa, etc. Now, treatment of marma injuries. So now I think we can connect the musculoskeletal disorders with the Nanatmaja Vyadhi presentations, the Vata Vyadhi presentations, which are the dhatus and upadhatus which are involved in that, and how Vata is producing the symptoms based on the dhatu or the upadhatu which has been affected. So now we come to the treatment of marma injuries. Marma injuries are difficult to cure completely even if all efforts are taken, unlike injuries to the other parts of the body. So we know that among the Roga Margas also, the Madhyama Roga Marga, which includes the Tramarmas and all the Marmas, Snayus, etc., the Sadhyada is very less over there compared to the Koshtagata Vyadhis and the Shakagata Vyadhis. So from that itself we can understand. And Vranavastus, Marma is one of the Vranavastu, and in what you call prognosis of the Vrana, it has been told that any Vrana in the Marmasthana is most difficult to cure, or it is incurable. So requires utmost skill and knowledge of the Shashti Rupakramas. Now, Marma Chikitsa, when we are telling, there is actually understanding the Marma points and applying the Shashti Rupakramas, and that is how Acharya Sushruta, in Vrana Chikitsa everything is hidden. In Bhagna Chikitsa everything is hidden. And understanding from the Sharira, the Marmasthanas and the Vaigalyas which are due to the Marmas is important, and the application of the Bhagna Chikitsa, Vata Vyadhi Chikitsa and the Shashti Rupakramas of the Vrana Chikitsa is actually the thing. Many a times it is held as a mysterious thing, and this is the mystery. This connection, if we don't know, it is a mystery, but otherwise it is not a mystery. So I earnestly request everybody to look in that way. That's why I am telling that use the Marmascope to understand the disease and also the treatment. General principles of Marma treatment is Santwana. Patient comes with pain. So Santwana, comforting the patient by your talk, your touch. We call it vocal anesthesia in Kerala usually. When we don't give, when a child comes with a fractured forearm, we actually don't give any anesthesia or any dislocation is coming. We don't give any anesthesia, but by comforting the patient with good words, distracting him from the pain, we immediately reduce the fracture or anything like that. So Santwana is very important as far as Marma Chikitsa is concerned, with good words, with good look, with good touch, etc. And Snehana to counter the Rutshana. Usually Marma Vigada causes Vata and Vata Pitta, Vata Rakta. The Chadoshma will be increased, Rukshatva will increase, Dhatu Chaya will occur. So, Snehanam is important. Jivaniyam, Dhatu, the Nasha, when it is involving a Sira Marma, lot of Rakta will be lost, the Jivana Dhatu will be lost, and any Sandhi also contains the Siras. So, another principle is Jivaniyam, or enlivening or improving the quality of the Rakta. Nowadays we can adapt whenever there is a, here only we have to understand about the shock, hypovolemic shock, etc. And blood transfusion and all are useful in the modern traumatic situations. Therapies are there. Brahmanam is the nourishing. So whenever Marma Chikitsa is treating a orthopedic condition, he does not stop with the disappearance of the symptoms. He will see that the total restoration of the function is made and the activities of daily living is restored. For that, Rasayana is required, and those medicines which are Rasayana for the Asti Dhatu and Majja Dhatu are given for a long period after the injury is healed. So, or enough period it is required for strengthening. Here the Vyayama therapy, the physiotherapy is also very important. Stambhana is blocking, like stopping Raktasrava as well as stopping the Vigrata Vata. When Vadagati is more, that is a Marma like Srodho Dushti Lakshanas, we can tell. It can be a Srodho Sangha of the Vada, it can be Srodho Adipravarti. Adipravarti Sangova Siranam Grandayo Viva Vimarga Gamanam. So these three all can cause Vimarga Gamanam also. So when there is Adipravrti, that is why when we are having a headache, when there is a throbbing headache in the Shankar region, we tend to compress the area. So that is Marma Chikitsa. We are giving pressure at the Shankar Marma to compress that area, the Adipravrti. So Stambana. Ropanam is healing of the wound, and Vata Pittagna, Chikitsa, Balya Rasayana, as I told. So methods Abhyanga, Pichu, Lebana, Bandhana, Veshtana, Trasana, Seka, Shirovasti, Nasya, Karnapurna, Pindasveda are all employed. And you can see that this is the normal methods. And above that, the Marma Prayogas are there, Marma Adangals are there, the many methods of Marma massages are there, which are the ones which are to be learned from the, which cannot be explained, but I can show some pictures for that. Here you can see that this patient has come to our clinic with a injury of the backbone, and then the bandaging, Vibandha Bandha in a particular way. We can see that it is not just encircling both sides, from both sides, clockwise as well as counterclockwise. This one is given with a pichu of Morivanna, which we use regularly. Now, Kerala massages, I would like to highlight on the Marma massage or Nadi Marma massage Chikitsa treatment. Kerala massages are Tadaval, Tirumal, Ulichil, Chavuti Ulichil, Talodal, Tattal, and Tepu, to shortly tell that. I know that these words are used mixed, where sometimes the patient tells that I went for a Tirumal Chikitsa or Ulichil Chikitsa, etc. But these words exactly defines the methodology of the massage. So when we tell about in modern Swedish massage, effleurage, petrissage, or kneading massage, stroking massage, tappotment or clapping, or shaking massage, we are carried away. But our own Shastra tells about the Abhyanga, Samvahana, Udvartana, Utsadana, Udveshtana, etc., etc. Like that in Malayalam, we have the words Tadaval, which is stroking massage. Tirumal is with a circulatory stroke, with a kneading massage. Ulichil is according to the contour of the structure, the muscles. For example, rotator cuff muscle, if it is massage, you know that it is a rounded structure and the hand should go in a rounded fashion. Chavoti Ulichil is done by keeping the patient on the floor with the sole of the foot, like with the palm. Talodal is a very simple massage. Balanam, Vradhanam, Sugumaranam. We tell that they cannot be, pressure cannot be given. So, very simple, tender massage is being done, especially for correction of the aggravation of Vata in such patients. We can, in day-to-day life itself, we can see that when somebody is in pain, if we do a small touch and then massage that area, the pain comes down. So, that is Talodal. Tattal is beating process, where a hard beat or striking is being given. Tepu is anointing, like we apply oil and then we call it Abhyanga. In Abhyanga and all, we are applying oil all over the body. So, or either in one limb, etc. So, that is called Tepu. And this is why this Tepu is, you can see that in Kerala treatment there is the Navara Tepu or the Shashtika Lepa. Now I will show some pictures where what is the different methods, like Marma Chikitsa methods, Marma massage methods. This is Pedanam or pressing, which we can see that I can tell that now the CCRAS has come out with a volume on Marma Chikitsa. The first volume, first edition itself was sold out in 2 years, and now the new volume, second edition has come. So these are there in the 6th chapter of the book, the Marma massage. So Pedanam is pressing, Paripedanam is over that. If you give a reinforced pressure, that is compression or Paripedanam. Samvahanam is a palmar stroking method, where you can see that along the hairline, the stroking is being done with the palm. Stroking is 2 types, finger stroking and palmar stroking. This is palmar stroking. Samvahana, which is finger stroking, I told now, just now. Then we have the Tadana or the beating method. Then we have the Mushti Tadana. You make the fist, and then with the fist we can do this in Swapa conditions, etc. When it is told, Mardhanam is told as a treatment for Vata disease, Vata Vyadhi, Vata Dosha. Unmardhanam is told for Vata Kapha. So whenever there is Swapa, which is due to the influence of the Kapha along with the Vata, pounding or mushti tadanam, etc. will be useful during massage. And especially you can see that marma areas can be handled in many methods. Friction massage or garshanam, which causes heat. Udgarshanam is the method with which Medo Vilayana massage we will be doing. Talodal, I told the gentle massage with fingers. And you can see that Sandamsha or grasping. Whenever you grasp or like Sandamsha, like tongue or a forceps, when you hold, that is called Sandamsha. Udvartana, that is why upward stroking with deep pressure. It is Udvartana. Wherever we are seeing, you can just tell that, see how we can hold the marma points when you are doing that. The other supporting limb is holding the gulfa and the kurcha shiro marmas to stabilize that and then doing it. You can see that my fingers are there in the Manibandha marma and the Kurpana marma when I am doing the anchana or pulling. Anchanam, anchayed adikshiptam. Whenever it is a overdone one, you have to do anchana. This is the traction. And whenever we hear about traction, we feel that it is a new method by the physiotherapists. But it is a part of the Bhagna Chikitsa, where it has been told that anchanam has been done. So, when we apply the Bhagna Chikitsa methods for Marma Chikitsa, in Abhyanga, etc., we see that there can be multiple applications which can be done over there. Adogadam cha upari vartayad, bringing the one which is gone down upwards. Anched adikshiptam, adogadam to upari vartayad. Ada avanadam unnamyam unnadam to avapidayad, where pidana has to be done. When it has been malpositioned towards the upper side, then it has to be compressed down. So such methods have been already told, and we are just in Marma Chikitsa applying all those methods based on Shashti Rupakrama and of Sushruta. Mardhanam, this is squeezing. Now we tell about the next one. I will show the Vimlapanam. Vimlapanam is one among the Shashti Rupakramas. Mardhanam, this is Mardhanam, where squeezing, kneading, where you press and give a pressure. This is a very comfortable thing whenever somebody is having neck pain. Actually, my hand is in the Tamil Marma called Kakatai Kalam, and then once you press and release it, then you know that it is our Amsa Marma region also. So when we do that, the pain in the upper arm, pain in the neck leading to the upper arm and all will be released. So here Vimlabna, kneading with the thumb, I am showing where Angushtayana, Taleyana, Pani Taleyana, Venunava, even if you can use a rod or a stick or a bamboo to compress or to roll over. So Angushtayana, you do it, you call it Akshara Tirumal in Kalari Chikitsa, where you don't move without moving the thumb, the area is compressed and a rotatory movement is given, rotatory kneading movement is given. Then you can see that avapirana or stationary compression. Here there is no massage, but only compressing and releasing, compressing and releasing. Here you know that everybody can observe that this is a marma point. It is a very, very important marma point. Even it is very good to revive any patient who is unconscious, like after Basti is unconscious or he is losing consciousness when some procedure is done. This point, once pressed and released, it will restore. It is modern, we all know that it is the secondary heart. But now whenever I do a class, I tell it is high time we think why Acharya named it as Indravasti. So it is the sthana of the manas also, where when Mohavastha comes, when the Indriyas do not function, to revive the Indriyas, the Indravasti marma has to be compressed and released, so that it has to be stimulated. There are two things we can do in a marma, either sedate that whenever it is Adipravarti and stimulate it when it is Alpa Pravarti or Sangha. So here it is Tamil Varma also is a part of Kerala Marma Chikitsa. The Agastya Marma Murai is being done. So Marma Adutal or Marma press, this sacral dimple area is we related to the a lower level to the Kukundara Marma, above it the Kadiga Dharana Marma. So here it is called Nanganam Puttu in Tamil. And here when we do any back pain patients, if we do a clockwise movement 3 times and anti-clockwise movement 3 times and release it, patient is bound to tell at least a certain percentage of relief immediately, a good percent of relief actually. This I told, fingertip stroking Akshara Thirumal with the other fingers. When you try to write a letter like Ma or in whichever language, you know that you are doing a deep fiber stretching or adhesion removal, trigger point release, or whatever is done in the modern physiotherapy. This movement of the skin, movement of the muscles underneath it, and the facial cover which has adheres to the bone. This determines how much pressure we are giving. So in massage we have the quarter khana massage, the half khana massage, the 3/4 khana massage, and full massage. It is what you call damaging. So we know that a marma therapist should know how much pressure should be given, depending on like Agni Karma, which Agni Karma method can be adopted, whether a Loha Shalaka or a Pipali Shalaka or a what do you call, any other method, Aja Shakra Shalaka, just which is used for. Like that, we should be able to understand how much pressure from the patient after taking clinical history properly and understanding the dhatu or the upadhatu which has been involved. We should be doing that. So Tattal is hitting. Now Korparena Taranam, this is also done sometimes when the force of the wrist is not enough, fist is not enough, hacking or pounding with the elbow is done. And then this is irikal or clinching, lifting, kneading, like the crab. The clinching is done in bakery. You know that they have a tongs, like that, catch with the tongs, like this is being done. These are part of the Marma Chikitsa in all musculoskeletal conditions. Now you have seen that I have been showing from the neck, the shoulder, the elbow, the wrist, the back, the hip, the knee joint, the foot, all these conditions, all these places where Marma Chikitsa can be done through massage and manipulation is given over here. Now Murukkal, this is also twisting kneading. We can roll the muscle like Murukkal, roll the muscle, catch the muscle and then roll it in between your fingers. And you can see that it is iruthal or grasping and pulling. This is very good in any heel pain, because any heel pain is not just of the heel. We have to understand that the calf muscle is inserting its tendon over there. So the pulling of the Achilles tendon or that kandara will give a lot of relief for that. See that whenever we are doing that, my other hand is protecting the Janu Marma. So these are small things which from Marma Chikitsa point of view I have to tell you. So this is Amartal or hand pressing with both the hands and compressing it. So treatment, internal medicines given by oral or other routes, external treatment given locally on the site of the Marma injury, and psychological and rehabilitative treatments are also advised. So here Marma Chikitsa give a scope for even all the methods I will tell, including the Daiva Vipashraya Chikitsa. More than that, the Yukta Vipashraya Chikitsa, application of drugs, more than that, the physical way, how as Acharya told, that Hastameva Pradhanatamam Yandram, how our own Hasta are so powerful in healing the pain, correcting the disorder, that we will be knowing by the Marma Chikitsa. Our own hands, our own fingers can do it more than any machines in physiotherapy. And along with that, psychology, that which Santwanam Acharya has told as the first Chikitsa for Marma, Vedana or Ruja, psychological and rehabilitative treatments are also advised. So external and internal medicines. So in Marma Chikitsa we tell that first is, if we can solve it with your hand, it is okay. But sometimes the damage is more for the dhatu. If inflammation is more, you will have to have medicines which is to be applied externally, then medicines to do externally and internally, and those medicines which are not, if kashta aushadhis are not enough, then we will have to use medicines of the animal origin, and if that is also not this thing for Valya Rasayana, we should be using dhatu or rasa aushadhis for that. So it's an entire gamut of the treatment. This thing can be used in Marma Chikitsa and we are using it also. Atangal Prayoga is a Tamil Varma Shastra method of controlled manipulation of the point to counter an injury to another Marma point. This may be called Maradatta as in Kalari Chikitsa also. There is a little difference over there. which is in detail only we will be able to talk. So, Aushadha yogas which are commonly used as Marma Gudiga Lagu and Brihat, Nagaradi Lepa, Marma Kashaya or Nadi Kashaya, Mustadi Marma Kashaya usually given. Murivanna, as you everyone knows that, I am thankful to my guru, Dr. G.S. Raju sir, who made it very popular in North Kerala also, or now all over India. Ashavanna is that which gives relaxation to the muscle. It's a muscle relaxant. It's a tendon relaxant. It is a contracture relaxant oil. All Kashaya and Thaila yogas mentioned in Vadaroga and Vadarakta Chikitsa can be used in Marma Chikitsa, like Kshiravalla, Shuddhabala, Kshiravalla Avarti, Dhanvantaram Thaila, Dhanvantaram Avarti, Balashwagandhadi Thailam, Sahajaradi Thailam, Avarti, which is given as Pana, Nasya, Anuvasana. Everything can be used according to the position of the or the location of the Marma in Marma Chikitsa. So I am not going into the Tamil Marma areas. I think these are particular Marmas which can be used in different clinical conditions. Let me conclude by telling that Abhada Varjanam Nityam Swasthavratasya Anuvartanam Utpannarthi Vigadanam Marmanam Parivaranam. First thing for a Marma Vaidya is to protect the Marmas, teach the everyone, the humankind, to see that he is having a good lifestyle, and if he is in an occupation, how to prevent any occupational injury to the Marmas, and also see that if there is any injury or any small symptom which is coming, that can be treated immediately through Ayurveda, Marma Chikitsa, Ayurveda, and other Indian systems of medicines, because whenever it is damaged only in modern medicine, it's called a disease. Whereas in Ayurveda, we can see that the Purva itself, we can see that, no, this is going to happen. So whenever a patient comes with a history of occupation, history of carrying weight on the shoulder, later we tell that be careful after 5 years, 6 years, or in any sports, after 6 years, you may lose the power of the upper arm, because so much of compression is happening on the Amsa Marma. So you should not. Now that is why in the mobile hand syndrome, we call it, like when the mobile phone is held in the arm, and then the fingers only are being moving, the wrist is held in an awkward position, and you are lying down in the bed and seeing the screen, then you know that our Kirkadika Marma, our Prashta Marmas, everything is in dislocation. Jihma Shayya Vijayashtaya. The first or the one of the hetus which has been told for Vidradi to occur. So every Vidradi occurs by Shofa. So we hear of much of fibromyalgia nowadays. Fibromyalgia are all due to uncared in what you call Shofa. So Shofa, if it is treated properly, and if that Shofa is there in the Mamsa, it can be treated easily. But if it is there in the Snayu or Kandara or where the joins the Asti, it becomes more and more difficult to cure. With these words, I wish everyone a healthy and happy new year, which is coming, and Marma Vijnana to become a better equipped Vaidya. I just request everyone to ignite their inquire, invest, involve, buy whatever is told. And I thank the authority, the director of the RAV, and the whole team, the administrative officer Ramakrishna ji, and seniors, all seniors who are blessing this occasion, and all the Shishyas who are attending this, who make us better gurus. Thank you very much. I am open for any questions.
Do we have any questions? If somebody wants to ask some question, can please ask.
Madam, I would like to get a feedback from Director Ji also. Thank you
I
for
can't
being
see any question in chat box.
There is.
Thank you so much, sir, for your insightful lecture. आयोजन समिति की ओर से मैं ऐसे ज्ञानवर्धक व्याख्यान देने के लिए अतिथि वक्ता डॉक्टर एनवी श्रीवत्स महोदय सर को धन्यवाद देना चाहती हूँ. आज के वेबिनार के अंत होने से पहले मैं हमारी निर्देशिका डॉक्टर वंदना सिरोहा जी को कुछ महत्वपूर्ण घोषणाएं करने हेतु आमंत्रित करना चाहूंगी।
Thank you, Dr. Jitika. Thank you, Srivatsa, for a detailed presentation. One query, as I can see in the question answer chat box, Dr. Jitika, I think we missed it. Can we use Marma
Yes, ma'am, it just-
for fibromyalgia? That is a query, sir, somebody has asked for fibromyalgia.
Madam, in fibromyalgia patient, can we give Marma Chikitsa? Surely, Marma Chikitsa can be a very good this one for fibromyalgia. At the same time, whenever we are doing an external treatment, I mentioned that Shofahara Chikitsa also has to be done. So here we see that it is a fibromyalgia where the Mamsa Dhatu, the Peshi Dhatu, after a long time being swollen up, or it becomes fibrosed. So here primarily when fibrotic changes occurs, then the muscles cannot expand or contract as we wish. So that results in pain. So the Marma massage therapy is very effective along with the internal medication Shofahara Chikitsa, whichever we are doing. So, sir, in case of Pachagada, can we do Marma Chikitsa? Sure, sir. There are, whenever we find that there is contractions or whenever there is flaccidity also, both ways in Marma Chikitsa, the basic thing is of restoring the prana of that area. So whenever the prana of the area is compromised, it can be resulting in Marma Chova, Marma. That's why we told that it can affect, if it is affecting the Vyana Vata, as in Pachagada, then we see that there can be contractures also, Akshayabagada. So whenever Akshayaba is there, Chipram Akshayaba Marana, when we start massaging on the Chipra or giving this one, slowly we can say if it is a clasped finger, after a Pachagada, today itself we can see that you can give a pressure on the Chipra Marma and then slowly the patient will relax the muscles. It may not be, it can be made permanent only with the required Sneha Sweda Chikitsa which has been done. But we can see immediately that the patient is able to relax it. So it is truly seen in our clinical situation also, sir. Thank you.
Thank you, sir.
Yes.
Thank you.
Yeah, thank you, sir, for your insightful lecture on this. Prior doing the Marma Chikitsa, one should be very much thorough in anatomical sciences. So आप पढ़िए anatomy आपका बिल्कुल thorough होना चाहिए. Then only you can practice Marma Chikitsa. That is a thing. Few announcement I would like to tell you that for CRAV course, I think all the gurus have already joined. For CRAV course, few mandates Ministry of Ayush has guided us that you need to give us monograph. सभी शिष्यों को monographs presentation देना बहुत जरूरी है. जो भी शिष्य हमें नहीं दे पाएंगे मोनोग्राफ, उनको हम एग्जामिनेशन के लिए अलाउ नहीं कर पाएंगे. Will not be able to issue the roll numbers for your examination. जो हम एग्जिट एग्जाम लेते हैं उसमें आप लोग पार्टिसिपेट नहीं कर पाएंगे. मैं इसीलिए सभी से रिक्वेस्ट करती हूँ, सभी गुरुओं से भी रिक्वेस्ट करती हूँ, तो प्लीज शेयर अस द मोनोग्राफ as soon as possible. Only few monographs we have received till date. So I would request all the esteemed gurus to please make sure that your sishyas have already prepared this, and there should not be any repetition of the monograph. It should not be like a copy paste document. आपका एक अच्छा स्टडी मिलेगा तो हमें एक कंपेंडियम हम बना पाएंगे मोनोग्राफ्स का. RAV is doing a lot of work in this. एक अच्छा काम हम करना चाहते हैं, तो I will again request to please share the monograph timely. And next CRAV exam is on 19th of January. That is new course exam. अभी किसी का कोई query है? Any query related to this? You may please raise your hand or ask any question. किसी भी स्टूडेंट या गुरु का कोई क्वेरी है तो प्लीज पूछ सकते हैं आप लोग. Apurjitika, I think there is no such query.
Yes, ma'am, I can.
Yeah,
In the chat
once
box.
again, thankful to Dr. Srivas for
Thank you
this
so much.
insightful.
Somebody is
lecture.
Vinod. Yes, Dr. Vinoda.
I think we
When-
are asking for the exit exam. Exit exam. Yes, we will intimate you. Most probably we will be doing it in the month of February. In the month of February, we will be starting it. But date we will be again sharing with you. We'll be decide on the date. Any other query?
Thank you, ma'am.
Thank you very much, Dr. Jitika. You may continue, please.
Yes. Continuing with the program, we will begin with the thank you note. Am I audible to all?
Yes, yes, you are audible. Please continue.
ओके मैं अपने मार्गदर्शक पद्म भूषण वैद्य देवेंद्र त्रिगुणा जी GBRAV अध्यक्ष को उनके निरंतर सहयोग, मार्गदर्शन और आशीर्वाद के लिए हार्दिक आभार व्यक्त करना चाहती हूँ। मैं हमारी निर्देशिका डॉक्टर वंदना सिरोहा मैम को धन्यवाद देना चाहती हूँ, जो RAV में सभी कार्यक्रमों के लिए मार्गदर्शक शक्ति हैं। मैं आयुष मंत्रालय के सचिव वैद्य राजेश कोटेचा जी को भी हमारे सभी प्रयासों में उनकी भागीदारी और प्रोत्साहन के लिए धन्यवाद देना चाहती हूँ। सबसे महत्वपूर्ण बात यह है कि मैं सभी गुरुओं, शिष्यों और अन्य विद्वानों को हार्दिक धन्यवाद देना चाहती हूँ, जिन्होंने अपनी उपस्थिति और सक्रिय योगदान भागीदारी से इस वेबिनार को सफल बनाया है। अंतिम में RAV आयोजन टीम के प्रत्येक सदस्य को धन्यवाद देती हूँ, जिन्होंने इस कार्यक्रम को सफल बनाने के लिए बहुत ही परिश्रम किया। धन्यवाद।
बहुत बहुत बधाई, बहुत बहुत धन्यवाद आपके सुंदर प्रेरणादायक उद्बोधन के लिए। हम राष्ट्रीय विद्यापीठ के और आपका बहुत बहुत आभारी हैं। बहुत अच्छा उद्बोधन रहा है आपका। बहुत बहुत बधाई, धन्यवाद।
थैंक यू सो मच सर।